Welcome, everyone. We're going to begin this webinar. We're having a little bit of trouble linking in Dr. Sanchez, who will join us midstream while we work out those difficulties. But yeah, today we're gonna talk about policies in schools and what's going on and what's going on in the current legislative session, and a few new events that are occurring through the Michael and Susan Dell Center for Healthy Living and through Active Life. So I'm going to turn it over to Marissa Rathbone, who is going to talk us a little bit about Healthy Texas Week.
Great, thank you so much, Steve. Welcome everybody to this webinar today. It's a real thrill for me to be able to present with Dr. Sanchez and Dr. Kelder today. Quite an honor. I wanted to tell you a little bit about Healthy Texas Week. If you haven't already heard, Healthy Texas Week is an initiative of It's Time Texas and a celebration of healthy living in our Lone Star State. It is the impetus for today's webinar, and more importantly, the inspiration for committing to healthy actions within schools, homes, businesses, and organizations throughout the state. It served as a motivation to start and strengthen healthy actions in your community, in your homes, and in your schools, and provides an opportunity to shine a light on what's working and promote those actions year-round. So Healthy Texas Week is really a celebration of what's happening and what we hope to see happening throughout the year. And we've had some really great events throughout the week, including a visit from Jared, the subway guy, yesterday. He went to the legislature and met with some legislators and also visited a school here in Austin. So it's been a really exciting week, and this is a culminating event here, part of the webinar.
Yeah, so Brooks, if you'd advance a couple slides, go down that coordinated school health. There we go. So I noticed a list of attendees here, and I know many of you, so thank you for joining us. I just want to sort of set the stage here, if you will, about what the recommendations are and what coordinated school health programs mean. And if you look at this slide, I got it, it's the CDC model, and this is what they consider coordinated school health. There's really two features that we need to think about. One are these different avenues of intervention modalities. So here we're talking about physical education, school health services, school nutrition, school counseling, school environment, health promotion for staff, family involvement in school health too. And all of that, encompasses a coordinated school health model. And within each of those categories of individuals or people at the school or the school district that have responsibility for certain sections of the school, a coordinated school health model would be one that would try to bring all these different responsibilities together and try and coordinate. Because there's a fair bit of research that says that, if you get multiple people, multiple sectors, all working on the same page, you're much more likely to achieve an effect. And in fact, when we think about, when I think about the research that I've been part of for a long time, my whole career, we can even go beyond the school walls and say that school-based programs can very much lay the groundwork for helping children make healthy decisions or making changes in their lives, etc. But if those are reinforced at home, if they're reinforced by community messages at parks and recreation or through the food outlets, etc., that the effects are bigger, they're stronger, and they're more long-lasting. So next slide, please, Brooks. But the two parts of coordinated school health, if you truly follow the CDC model, is thinking about those 8 different layers inside a school, which we saw on the previous slide, but also 6 behaviors. And this is where I put on my epidemiologist hat rather than my interventionist hat. And that is there's 6 behaviors that children engage in, and yes, they do them at different ages, at different levels. But these 6 behaviors account for the majority of acute and chronic diseases. So acute diseases are defined by things that are happening right now, like an infectious disease, or things that are very present in today's life of children. And then the chronic diseases, particularly ones like diabetes and cardiovascular disease and cancer, they have an accumulation of lifestyle decisions that last sometimes over decades that can lead to premature death. So just look at these different behaviors. So there's intentional and unintentional violence and injury. Those are acute behaviors. If you think about getting hurt or bullied or shot or any of those things, Tobacco use is more on the chronic disease, alcohol and other drug use, sexual behaviors that may result in HIV or other sexually transmitted diseases or unintended pregnancies, unhealthy dietary behaviors, and physical inactivity. So these 6 behaviors, when cross-indexed, if you will, with the 8 categories of ways to intervene, would be a truly coordinated school health model. Now that's pretty hard to do, I would say, and not many schools can fire on all cylinders across that matrix that I just described. So, either good or bad, there's professional silos across professional organizations or even within the school, where food service and physical activity and the HIV or drug counselors, et cetera, may or may not work well together, or even have different pathways, different priorities with their profession. But that's the goal for coordinated school health. What we're going to do today, though, is we're going to shrink it down a little bit and think about coordinated school health as it pertains to fitness and physical activity. That's what we've been talking about a lot lately in the Healthy Texas Week, is really in the dietary and physical activity. Today we're just going to talk about physical activity because it's hard to talk about all of them.
And just on that note, Steve, one important thing to remember is that we're not asking for schools or communities to do coordinated school health perfectly. All we're asking for you to do is to start taking pieces from it and start working towards improvement in various sectors. So today, like Steve said, we're going to talk specifically about the physical activity and physical education component, because we hope that the information we provide will help you strengthen at least that arm of the coordinated school health model. It's never too late to do the right thing, so we're just asking you to get started.
Yeah, exactly. Next, please. There you go. So this is part of a report that I prepared a while back, and I should say, if you're just joining us, we're talking about physical activity in schools. We're talking about coordinated school health, and if you've entered into the screen, just look at a little green rectangle at the top of your screen. If you click on that and press the chat button, another box will open up on the right-hand side. You can ask us questions. So we're really here to answer your questions as much as present today. So, but anyway, what you see in this slide that I call the whole school approach to physical activity. I wrote a report last year for the RGK Foundation, just trying to think through the variety of ways that we can influence schools and local communities and possibly policies that could be proposed and hopefully enacted. So when you look at the whole school model, look at the very bottom where it talks about state policies, monitoring and enforcement, parental notification of policies, progress, and performance. That bottom layer is referring to setting the stage for telling schools at the state level or informing schools about what they can and should be doing. So policies direct people. They call attention to issues which professional organizations and what elected officials through the legislative process would consider as important. So right now we have some policies of real interest. 10 years ago, when Senator Jay Nelson and others put together Senate Bill 19 that required physical activity, physical education, and coordinated school health with regard to diet and physical activity. That was a landmark piece of legislation, not just in Texas, but throughout the country. That was extended in Senate Bill 530 to middle schools and really set the stage for policies. Following that, it led to monitoring through the FitnessGram testing. So Marissa's going to talk in a few minutes about what's on the agenda today with regard to FitnessGram and testing. But from my perspective, a good way to go for state is to have the policies, but have some way to measure whether it's being enacted. And we have surveys from the Texas Education Agency of the SHACs, which are school health advisory councils across the state, trying to get at this notion of whether or not schools are able to and are doing the things which are listed in the policy framework. Additionally, FitnessGram allows us through the testing procedure to take a look over time whether we're seeing progress. I mean, all these policies have an intention to improve the health status of children, and so FitnessGram would allow us to tell us that. The other thing about FitnessGram, which I'll admit I was a little disappointed when the law went, or the policy went into effect, is that it's not required to notify parents about the fitness status of their children. And if you go way back in time as to when the Cooper Institute developed the FitnessGram, part of the reason why was so that PE teachers and school personnel could better and more accurately judge whether or not their children in their class were fit or unfit, and possibly they could even tailor a plan for individual children or individual groups of children in order to raise their fitness level, but also to send a notification, a parent report card, if you will, about fitness, so parents can be informed. And we know that schools can't do the job by themselves. They need parent involvement. It's often tricky to get parent involvement in a big way. One way is to send the parental notification home, and the FitnessGram software has the ability to prepare parent worksheets. Does it not, Marissa?
Yes, absolutely. And on that note, we look at fitness assessment, generally speaking, as a really important measure for determining how well, how effectively, not just our physical education programs are working, but also how much information is going home to students from their families. So we don't expect that schools are going to solve the problem of physical inactivity or poor nutrition, but they're certainly part of the solution. Fitness assessment is one way for us to get information that helps to evaluate how effectively we're communicating that need. So again, there is some conversation and controversy ongoing about fitness assessment in classes and how that's communicated and used, and we agree that the fitness assessment data should be used in a thoughtful way and conducted in a thoughtful way as well, but it's critical in evaluating students in all curriculum areas. So one of the conversations we have consistently up at the Capitol is we expect all of our educators, whether they're teaching math, science, reading, or social studies, to do a variety of different types of assessments with their students to determine how well the curriculum is being instructed, how well it's being facilitated and implemented. And we expect the same expectation of our physical education teachers as well. So we are continuing to help provide information and support to our decision makers about the value of fitness assessment. We certainly don't feel it's the only measure that's important, but it's a starting point and a good place for us to move forward. So, and when paired with a quality coordinated school health program, including parental involvement, we see comprehensively that positive changes occur at the district level.
That's right. So let's go back to this figure. At the top, the roof of the house says 60 minutes of physical activity. And I thought it's important, and continue to think it's important, to put that out there as a target. The 2008 Physical Activity Guidelines recommend for children 60 minutes or more of physical activity per day. So your average child, should get 50 minutes or 60 minutes at a minimum. Kids who need fitness improvement or who might be overweight probably need more than 60 minutes per day. And remember, obesity is diet and physical activity. Fitness in and of itself has all kinds of important health benefits that go way beyond just controlling your weight. So the foundation at the bottom of the chart is the state policies and enforcement and parental notification. I endorse those. But the rest of the boxes above really try to look at the school and see, can schools take on the challenge of providing 60 minutes of physical activity per day for kids? Can they, should they, will they? Well, of course, it remains on all the local circumstances. But here's the categories as I see them. Certainly, physical education can supply a lot of physical activity. You could get half or more of your 60 minutes per day right in PE class. However, you need to see that you probably can't get all 60 minutes in a physical education class. There's just not enough time to do it, and not all that time is being spent being physically active. There's a lot of instruction which goes on. There's communication of health principles and nutrition principles, and teaching about how do you swing a bat and gross motor skills to how exactly do you play baseball or football or soccer. There's rules to be learned too. So we can't get it all in PE class, although I wish we could and it was longer and that was every single day. Another thing at the beginning of the day and at the end of the day is active transportation, and I listed that at anywhere from 15 to 30 minutes, because most kids won't walk farther than 10 or 15 minutes to get to school and back. So that's probably the maximum is 30 minutes, because then you get into busing and safety of the neighborhood and things of that nature, climate, etc. But certainly there's ways to do it, riding a bike into school, walking to school, and if your neighborhood is one that lends itself to that, then you should go ahead and do it. And a lot of the active transportation movement comes from money allocated through the Highway Department of Transportation. They've rebuilt a number of ways to go ahead and do that. If we look in the middle, we've got before school open gym, classroom brain breaks, and then after school programs. Even without PE, you potentially could get 60 minutes just for those avenues. In middle schools and in high schools, a lot of kids congregate and mill about waiting for the school to open, and you could, constructively use that time by opening the gymnasium and putting out some equipment. And so either the kids are wandering around outside the school, or they're inside the auditorium. And what we found is when we've asked schools to go ahead and do this before school, is they'll take 1 grade's worth per day and then open up the gym, because you can't fit everybody in the gym. And we've measured a lot of vigorous physical activity. I think you could potentially get 15 to 30 minutes at least for one section of the school. And the teachers that we talk to in first period say the kids that are doing that are much better behaved. They're coming to school a little bit more settled and ready to engage in the day. We've done this a lot in Austin and AISD, and Round Rock and Pflugerville, and Del Valley too, for that matter. And it's worked really exceptionally well. Nothing but positive for that. Brain breaks, everybody's talking about brain breaks now. So when should you do them? How should you do them? You can just Google brain breaks or activity breaks and find a long list of them. And what we mean basically, and particularly with middle school and high school, but elementary too, the classes where the kids are sitting for a long period of time, little kids, it's hard to sit for 40, 50 minutes in a row.
Big kids too.
Big kids too. So we're working on, actually I'm working on a grant right now that will look at 3 different presentation modalities. One where the teacher will present the activity breaks, one where the teacher could elect student leaders for maybe through student council or other areas to lead the breaks for the teacher, so they get some leadership and presentation skill building, or having it through video. The HopSport videos that many of you have out there, they have activity breaks built right in. It's a little trickier to get it pumped into each classroom, but it can be done. So very good benefits to brain breaks. Highly outlined, a big report from CDC a couple years ago. A new meta-analysis came out just last week on this very topic. After-school programs, if done well, can supply all 60 minutes, maybe even more, depending on the setup of the after-school. So I guess what I'm trying to say is I think it's possible to do it, but like anything with coordinated school health, you need the goodwill of the district, you need the goodwill of the principal, you need a strong teacher and district personnel, and then the teachers to go along with it. So it takes a fair bit of effort to get everyone on the same page. And then finally, I'll just mention last two, and Marissa will talk about this. Senate Bill 1018 covers the last two up on the top: school facilities and local fitness subcommittees. So each school district is required to have a shack, and each school is required to have a campus improvement plan. If you ask them to think about fitness and physical activity, if it's not planned and if it's not measured, it most likely doesn't get done. So there's a bill 1018 which asks both the state shack and the local district shack and the campus improvement plan to consider adding planning with regard to fitness and physical activity, because it's so important for student learning, it's so important for weight control, it's so important to set that foundation of movement skills to generate all the benefits of it. Anyway, and then joint land use agreements, that committee then of parents and school personnel could take the responsibility to figure out how best to do that in their local area. It's hard to have a one-size-fits-all, so some locality has to happen.
Yeah, and I'll speak a little bit more to that when I talk about House Bill 1018, but one of the things that we typically see is the schools that do have joint land use agreements with community organizations, after-school programs, really the potential list is endless, is that joint land use agreements are beneficial not just for the students and the families, but also for the school itself. Oftentimes, nonprofit organizations bring in resources that the school might not otherwise have. For instance, a local farm building or garden facilitating organization, like here in Austin we have Sustainable Food Centers. Sustainable Food Center has partnered with some of our schools to build gardens at the actual school site. Sustainable Food Center then builds relationships with the school system and the youth and their families, and the school gets a really great, very cross-curriculum activity that combines health, physical activity, science, and math, in which the students really can feel engaged and present to their campus, and it stays on the campus. In addition to that, with some of our after-school programs, students may have an opportunity to participate in after-school programs where parents or family members actually pay the school or pay the company that's doing the after-school program, and the school might get a cut for it. So the after-school joint land use agreements, that's a tongue twister, can be revenue generating and opportunity generating for schools where they may not otherwise exist. So
the joint land use is interesting that way, to the point that you, instead of always putting an unfunded mandate on top of things through state policy to offer an opportunity to generate some revenue, there's no reason not to, really.
Yeah.
Next. I forget which one is which. Can you hear me?
Yes.
Yeah, very good. Thank you. Sorry, I pushed the mute button real quick and I didn't know the difference. Actually, this is Marissa's part, so I'm going to turn it over to her. And I don't think I properly introduced you at the beginning, Marissa. She was formerly working within the TEA, Texas Education Agency, has done so for a number of years, and recently has switched over to Active Life, and is now working within the policy arena as well as program implementation and all the good work that's happening there at that organization. So why don't you tell us a little about your organization first,
Sure, yeah.
what your new role is,
yeah.
and then we can jump into the legislative session.
You bet. Thank you, Steve. So yes, so I was at the Texas Education Agency for 7 years as the Director of Health and Safety there, and doing a lot of similar work to what I'm doing now with Active Life and It's Time Texas. The nonprofit that I work for now, if you are not already aware, is a health promoting, health supporting, health inspiring organization whose main mission is to make healthy the norm. And we believe that there are a variety of ways to do that, much of which Steve and I are talking about today, really through a coordinated school health model. We started as an organization focused on after-school programs, very student-centered, and we still are very student-centered, student-focused, but we've expanded our reach beyond simply schools and realized that in order for schools to do their jobs as effectively as possible, we must bring in community partnerships as well as parent support. So we're looking truly at a community model for developing healthy people, not just healthy students, but healthy people, because we realize that we can do a lot in school systems, but even if you were to be able to get 60 minutes per day with students on a school campus, we really want the parents to be modeling, the parents or guardians in the community to be modeling healthy practices as well. So schools, community organizations, and homes are critical to ensuring that students and youth and parents and community members are getting all the information they need to make this work. And that's really the message that the organization I work for, Active Life and It's Time Texas, is trying to communicate and support all of you in doing. So one of my primary areas of focus in this current position is to help support policy and legislation, and to communicate the opportunities that are available to all of you to advocate for your beliefs and for school health and community health. So a couple things I just wanted to go over, and some of this may be old news to you, but bear with me while I share this information with people who are just joining this policy arena. I think a lot of times when you look at that pink dome up there, it seems intimidating. And once you get a little bit of experience over there with the people who are inside, you realize that it's a very welcoming, open environment to talk about what matters. And at the very beginning of it, it really matters that you're using at least some proper terminology, because at the end of the day, sometimes one word makes all the difference. From all of our perspective, I think one of the important things for us to focus on is the difference between lobbying and advocating. A lot of times we get scared that we might be saying something that we're not supposed to. I know that that's true for government organizations, universities as well, as they are part of the government. So in those capacities, in my previous capacity as a Texas Education Agency employee, there was no lobbying allowed. That essentially means the true difference is that when you lobby, there's a specific issue or piece of legislation that you are doing everything to encourage people to vote specifically on. So if you take a specific bill and you are a lobbyist, let's say, your primary goal is to go out and gain support or opposition for a bill by really asking people to do something very specific around that bill, either voting for or against, or lobbying for or against. Advocating is, I would use an analogous word, which would be education. So you are educating the public, legislators, legislative staffers on a particular issue and the value of supporting different different pieces of legislation or issues surrounding legislation. So I would think of advocating as educating, whereas lobbying is pushing an agenda, very much so, which we need lobbyists in different areas in order to make things happen. But for all of our cases, I imagine most of you are joining us from an advocacy standpoint. May versus shall, very important. May versus shall is critical because may means you don't have to do it, shall means you do. So that's important, particularly with schools, because oftentimes we see that there's legislation that has a may, but those things aren't being done just because time restraints are so significant. Shall means it is required, and far more likely required to be done in the school system when you have a shall. I'm going to take a little bit of a break so that we can introduce our next panelist.
Yeah, sorry to interrupt you, Marissa, but Dr. Sanchez, I see, has joined us. I just want to make sure we can hear you, Eduardo. Let me know, say something, see if we can hear you.
Can you hear me?
We can hear you. Very good. So I want to thank you for joining us, and we have a number of people in the attendee list. So Marissa and I jumped in front of you, given the technical difficulties that we had, so we're happy you could join us. But why don't you tell us, Eduardo, if you don't mind, because we're in the middle now talking about policy and the importance of policy. And from your perspective as the former Commissioner of Health and Chief Medical Officer for the state, tell us more about policy and why people in the audience might want to get involved with it.
Well, policy is what drives the things that we do. I do think it's important in terms of the legislature and law that there are two ways to move policy forward. Of course, changing the law is one of them, or adjusting the law. And I see on the slide that's on the screen, there's more to be covered, and that's great. There's also another way to change policy, and that is by way of rules, regulations, and operating within what are the guideposts, if you will, for in the case of a state agency, what are the guideposts for the executive branch, for that agency to do its work. Sometimes those guideposts can be virtually expanded. And sometimes they are quite intentionally narrowed by folks, sometimes the governor's office, sometimes legislators and or committees have a way of narrowing those guideposts. But there are ways to move the needle, and there are certainly ways to have the conversations about issues by pointing out what might be some of the consequences of the policies that are in place. More importantly, pointing out what might be the opportunities to improve things by changing policy. Just one quick thing about 4 Ps that I think are one way that I thought about the issue of policy when I was the Commissioner of Health and still feel like it is relevant. One is the issue of perception. Are the folks that you're going to talk to ones who believe that there's an issue that maybe you think is important, but presents an opportunity to change that perception, maybe raise awareness and even change attitude? The second one is practicality. Is a policy change one that will have the effect of creating the ability to alter things? And perhaps one very clear example of practicality, irrespective of what you think about the issue at hand, was the ongoing discussion and now halting of the policy that was going to make it difficult for folks in New York City to buy big gulps, if you will. And in fact, big gulps weren't the issue, because I think 7-Elevens were protected, and that's part of the practicality question. The third one that one hears all the time, Marissa, you may remember this one, it's price. What's it going to cost? And that's very, very, very important. And there are ways to frame issues in ways that have to do with the not only the fiscal, but the other potential benefits of a program. So it may cost money, but there may be some positive result on the other end. And then the last that trumps everything is politics. And I've been thinking lately that the policy world is one that's a little bit like the game of chutes and ladders, because you can make a lot of progress and make a lot of progress. And if you remember, I think in that game, you can get to number 98. And if you hit a 1, you are going down all the way to the start of the game. And there are times in the policy world where you advance the ball, and then at the very end, things don't quite work out. That is still a net move forward. And in the policy world, how we measure success is a little bit different than how we measure it in other realms.
Thanks a lot for that commentary, Eduardo. I just want to let the audience know that we realize we've had a little bit of technical difficulty. We might go over. So feel free to type questions in right now. We're going to be able to see them, and we will answer them as we go. Feel free to do that, and if you can stay a little bit longer, that'd be great too. So anyway, Brooks, if you'd advance to the next one, we'll turn it back to Marissa, and then join in as you can, Eduardo, when you have thoughts.
Yes, and thank you for your comments, Eduardo. I really like your perspective that we advance to a certain level during the legislative session and sometimes don't see all of our advocacy efforts come to the full level of success that we had envisioned or hoped for. But at the end of the day, the relationships that are built, the momentum that we gain, advances the cause significantly regardless. And so we're going to talk a little bit about the current legislative session and some examples of that already. But in the meantime, I also want to just give a little perspective. Like I mentioned earlier on, we often see the dome, the Capitol building, as this very large, very potentially intimidating space. And that is true, I think, for somebody first coming in. So I don't want to discredit the fact that that might be your experience or has been your experience, but I really think it's important for you to understand that it is designed, that building and the people within it are there to welcome and invite outside commentary, outside perspective, and outside education and information. What you know is critical to be shared with the people who are making policy, developing proposed legislation, because you are the ones that inform how those decisions progress. A little bit about just how the session works. We bounce back and forth between offense and defense pretty regularly and extensively. So by that I mean there are bills that we are in support of, that we are trying to be sure we're providing education, information, and coordination around that are positive, that help promote school health or community health in a variety of ways. Quickly, though, we also find that we also have to play defense. So while they're trying to add more positive things to school systems, they're also taking things away. Yes, sorry. Hopefully there was no feedback there. So we have to bounce back, and sometimes within the same day, we're playing offense and defense on different types of bills or different proposed policies. So you've got to be ready to do both. Another important thing to remember is that yesterday is old news. So what happened, good or bad, yesterday, you should really not forget, but consider that today is something different, and anything can happen. So one day you might find that there is a legislator or a group of constituents that are extraordinarily supportive about a bill or proposed piece of legislation, and then the next day the opposite occurs and they're no longer supportive of it. So really it's anybody's ball game, and to stay on top of things is critical. And to not give up hope is also critical as well. We have to keep pushing forward. It's the only way to make things happen. Like I referenced before, the door is always open, and I mean that literally. The legislative staff in each of the representative and senators' offices are there to receive your comments, your concerns, your resources, and information that you have to share. My experience has been, particularly during this session, because I've been able to go into the building and meet with legislative staff regularly, is that they are excited when you walk in and have information to share with them, and they often will sit down and learn from you. You can't expect legislative staff or the legislators themselves to be experts in every area that impacts policy throughout our state. So they really want to hear from you because you can help inform how they move policy forward. So they are your friends, and they do want to hear from you, and they will listen.
Yeah, if you don't mind, Marissa, just to make a note, yesterday, well, Marissa and I actually, we hosted a breakfast yesterday with Dairy Max and Fuel Up Place 60 in the Dell Center, and some other partners, and so we invited the program staff or the legislative staff to come. We invited the representatives and senators themselves. We had the Chancellor of Health for UT, Ken Shine, dropped in. The Commissioner of Education dropped in. A few elected officials dropped in, and then afterwards we went up to the offices and did what just Marissa was talking about. So I'll admit, several years ago I was very intimidated about going in there and not knowing everything, especially as a professor claiming that I know a lot. It can be challenging to get your head screwed on and make sure the right way and try to know everything. But the more I go there, the more often I think, well, this really is the right thing to do. And it seems kind of ephemeral in a sense that you go and you talk to people and you tell them something, and whether they'll remember it or not, or it's hard to judge exactly where they are in a particular position. But I do think if nobody goes, then someone else will, right? And Eduardo, do you have comments on that when you were a health commissioner, or even afterwards?
Absolutely. There's a couple of things to say. One, I completely agree with what Marissa was saying, and that was the P when I said politics, where you can have everything lined up, people are your friend, they're going to vote your way, and then all of a sudden something happens where they have a change of heart. And sometimes that change of heart has nothing to do with the issue that you were dealing with. It has to do with a different issue, and two legislators get crosswise, and maybe part of that, the deals that are done behind closed doors involve letting go the issue that was so near and dear to our hearts. A couple of things in terms of this. I think it's really, really important to get to know legislative staff. One, making yourself seen as a go-to resource. If they call you, that's a great, great thing. That means you've made it and they see you as a reliable source of information. And sometimes you may not even agree on an issue, but if you're seen as a honest broker of good, solid information, you will be called on. Committee hearings are theater. They're important, but they're theater. The work that really has to be done, I think Marissa and Steve would agree with me, is the work that's done in meetings with staff and offices so that you can, prepare staff and their legislators for those hearings, and then also you have a way to work behind the scenes after the hearing to address what may be perceived as either a difference of opinion or a misunderstanding. And the last thing I'd say is those relationships are ones where you ought to work to get invited to provide testimony rather than inviting yourself and volunteering to provide testimony. Invited testimony has a little bit more oomph than just presented testimony. All of that happens by building those relationships, using your knowledge and your information base as a resource that they ought to think about going to.
Thank you very much, Eduardo.
Yeah, that's right, and it's easy to do, I guess, from my office because I can walk to the state capitol, which is why I've been doing more and more of it as I move from Houston to Austin. That's why these professional organizations are here, because many of them are there to do just that, to represent you. And so participation in professional organizations, I think, is an important thing as well. Next slide, Brooks.
Actually, before I talk a little bit about proposed legislation, I just wanted to piggyback on what Eduardo was saying. Another important thing to remember is that the relationships that you're building with legislative staff and legislators this session are valuable for next session. So while you might not see a bill pass that you are particularly excited about this session, we often see bills resurrected in sessions later on in the future. So an example of that is actually Senate Bill 65, which is listed here on this slide. Senator Nelson filed a bill about a healthy school recognition program, which would give the Texas Education Agency the opportunity to identify and recognize schools that had met specific criteria showing evidence of school health and coordinated school health programming. They are required in this case, were the bill to pass, to have the minimum expectations for school health policy implemented. So you have to have a school health council in place, you have to have coordinated school health programming adopted, you have to have the minimum physical activity requirements mapped out. So the great thing about this particular bill is it's a very positive, very proactive, and it is a bill that was filed during the 82nd legislative session. It did not pass. It's the 83rd legislative session and has already progressed further this session than it did last session. It was introduced during Senate committee hearing. It passed through there and was voted out of committee, so now it will be referred to the House side and heard on the House side, hopefully to progress through and be adopted. It allows the Texas Education Agency to accept funds from outside sources so that they could actually provide mini grants or recognition and incentives to school districts that had applied. So I really was excited to see that a bill came back from the last session that shows that there was enough momentum built and enough relationships built during the last session to show evidence that it needed to come back. So that's just an example of how this session is really building an infrastructure for the 84th legislative session, which will be conducted in 2015, which seems like a long time from now, but by the time we're able to implement all the bills that are passed this session, we'll be ready to help strengthen what we currently have in place. Going back to House Bill 1018, which both Steve and I have referenced already, is a bill that was filed by Patrick, and it strengthens the existing school health advisory councils. On a previous slide, I mentioned the difference between amendments and additions. In any proposed piece of legislation, it will say whether or not it's added or it's amending an existing piece of legislation. So House Bill 1018 would be an amendment to the current School Health Advisory Council requirement. In essence, it would require that SHACs, already required of school districts, would have a fitness and physical activity and education subcommittee that would focus on a lot of the issues we're talking about now, again, as a way to strengthen local efforts, provide some guidance to the school board and to staff about how to take what they're currently doing and make it better, as well as requiring the SHAC to consider and make recommendations to the school board about the importance and opportunity for joint land use agreements within communities. So keep an eye on both of these bills. They do have some positive momentum, but an added push from constituents who believe that these particular elements are important would speak volumes to the legislators and legislative staff to move them to the next level. There are many, many steps in the legislative process. Things don't necessarily get killed intentionally, but sometimes they just die because there aren't enough people speaking for or against them, and so they fall off the radar. So participation, like Steve mentioned before, is critical because participation really has to come from constituents in order to move policy forward.
Hey, Marissa, this is Eduardo. In the interest of, we're health people, so I think we ought to talk about bills going into hibernation as opposed to dying or being killed.
Good point. And speaking of participation, if you're out there, please write your questions in. We're a tiny bit over our allotted time of what we had scheduled, but we can continue on. So if you need to leave, please do. But if not, if you could stay, we welcome you and write your questions and we'll answer them. Go ahead.
So I was just speaking about bills that are a little bit more on the offense, the positive promotion of things, issues that we currently believe in. I also want to talk a little bit about defense. So there are several bills that have been filed this session that would eliminate or significantly reduce the impact of fitness assessment. They've been moving in a variety of different forms and fashions. They've started out as bills and they've been tagged on as amendments in different parts of the legislative session. Those numbers are not included here because they are a little bit of a moving target, but I would recommend that you stay in communication with us if that's an area of interest, and also even proactively communicate with your legislator about whether or not you believe that fitness assessment is critical and important and how it might best be used. Again, as Steve and I mentioned earlier on, assessment is part of any quality learning environment regardless of the content area, and fitnessgram is one way that we hope and believe that physical education teachers can show evidence of their impact and to identify areas for improvement. As professionals, we all have areas in which we need to improve, and the only way to determine how to do that effectively is to evaluate our current work. So fitness assessment, fitnessgram is one way for us as a field to do that. There is a component of Article 11, which is the budget, that includes fitness assessment implementation funding. Currently it's allocated in the amount of about $5 million. If you feel that fitness assessment funding, which would be a supportive funding for both the Texas Education Agency and for school districts in implementing this requirement, if you think that would help move this forward, please communicate with your legislator. There were also several pieces of legislation by Nelson and Alvarado that would reinstate the health and physical education requirements in high school. We have seen some discussion related to that, but I'm not certain that it is moving forward at the pace that it needs to in order to happen. Again, if you care about these particular issues, communicate with your legislator. I would recommend that you visit the Texas Legislature Online website. That link is the first link provided there for you. If you click on that link and go directly to the website if you haven't before, it will allow you to search for bills by number or by subject matter, and also determine who your state legislators are, as well as your congressional legislators, and also your State Board of Education members with their contact information so that you can communicate with them very easily and quickly. There have been multiple webinars during this legislative session, both by the Michael and Susan Dell Center, as well as the Partnership for a Healthy Texas, as well as my organization, that have provided guidance on how you can communicate with your legislator in a very easy turnkey fashion. If you would like to access those resources, I would start here at the Michael and Susan Dell Center website. They have some advocacy tools as well as bill tracking information, so you can track bills that are relevant to our field without actually having to dig into the Texas Legislature Online website itself. So they've done a lot of that work for you. Again, I would encourage you to stay informed because your participation is critical in order for us as a field to move this ball forward. Go ahead and progress to the next slide. One thing, and we've talked about this pretty extensively already, but one thing I want everyone to remember is that we already have great policy in place. In fact, of the states in the United States, Texas is really leading the charge when it comes to existing school health policy. We have school health advisory councils, coordinated school health, requirements to include coordinated school health goals and objectives within campus improvement plans, which is really how we evaluate and measure whether the goals and objectives of individual campuses and their leadership are fully implementing their goals throughout the course of the school year. We have fitness assessment requirements still in place. It is required that health and physical education standards be taught in all grades K through 8. We still have a 1-credit requirement for physical education for high school graduation, and many school districts are opting to increase that, or have already opted to increase that to include more PE and at least 1 semester of health. And we have the requirement that all students in grades on an elementary school campus get at least 30 minutes of moderate to vigorous physical activity, and at the middle school levels that they get at least 4 semesters out of 6 of moderate to vigorous physical activity on campus. So we've talked extensively about the importance to participate, and I will continue to advocate for that you participate to move these policies forward. But even more importantly, I want you to remember that regardless of what happens in any legislative session, you still have these policies that serve as a foundation for everything that we do. We know that a lot of you are going above and beyond what's expected or what's required of you, and we thank you for those efforts. That's how we model throughout the rest of the state. But what I want you to also remember is that regardless of what happens on May 27th, which is the last day of the legislative session, we still have so much that we have to work with to move our work forward.
Great, thanks, Marissa. Anything you want to add, Eduardo, before we start closing this down? I'm not seeing many questions from the audience, but go ahead.
I don't think so. I apologize for not having, well, let me put it this way. I apologize for having had the technical difficulty. I went to a second computer and it worked. So maybe,
Good.
Maybe that's another point is, you know, in this policy world, I think what y'all have heard is that try and try again. And every experience is worthwhile. You learn, you establish relationships, and sometimes the next time around, rather than starting at 1 in the chutes and ladders game, you get to start at 50 in the chutes and ladders game, and you may indeed have a higher probability of crossing the finish line.
That's good advice. We're gonna close this webinar off. We're a little bit over schedule. Those of you who are still here, just want you to know that you can find this webinar in its totality on the MSD Center website, Michael and Susan Dell Center for Healthy Living, as you can find all the webinars we participate in. If you like this webinar, please go there and send it to your friends. And I want to thank Eduardo and Marissa for joining us here at the MSD Center, and we'll continue to do these things. And Eduardo, before we leave, do you want to tell us anything about your new job at the Heart Association?
I'm very excited to be joining the Heart Association. I plan to be involved in some of these policy kind of discussions at the national level, having to do with everything from childhood obesity to heart health. And those of you who have known me or heard me speak in the past, I will be focusing as much as possible on those upstream kinds of things, in addition to the things that happen in the medical care delivery system.
All right. Well, we look forward to great things coming out of you and the Heart Association. I'm happy you're in that organization. And until next time, we will talk to you all later. Thank you much for participating. Bye-bye.